Okay, cool. Sabita, you can start.
Good morning, everyone, and welcome to Coping with COVID-19 Wave 2, hosted by the Lead India DBA Foundation. Lead India Global is a brainchild of Dr. Kalam's Vision 2020 and was founded with a mission to provide affordable quality healthcare, affordable quality education, preserve and protect the planet for future generations, and develops spiritual families to establish peace and harmony in the society. Lead India also conducts value-based leadership training programs to transform the youth into responsible citizens and engage them in developing the nation. The COVID-19 pandemic has impacted the global healthcare, education, economy, and employment due to restricted mobility, especially our youth who are undergoing a lot of stress and gradually losing hope since schools and colleges have been impacted. The Lead India Foundation USA has been hosting a series of webinars on the impact of COVID-19 to instill hope and encourage our youths to be safe and positive about our future. Throughout this webinar series, Lead India is bringing global healthcare professionals to provide expertise guidance to address the COVID-19 second wave in India, and some of the practices can be applied the world over. At this point, I'd like to warmly welcome our chairman, Dr. Harry Ipinapoli, who has demonstrated great leadership throughout the pandemic and before that. Dr. Ipinapoli, I welcome you to give your welcome address.
Thank you. Thank you so much, Sabita, for such a wonderful introduction to the Lead India Foundation. And also would like to welcome to all the esteemed guests. Good morning, good afternoon, and good evening, since we have attendees from different parts of the world. So there are also, we have government agencies, NGOs, and civil societies, academic institutions, women, youth, and students also attending this session, watching from different channels. The Lead India greetings and congratulations to all the people who are here today, and especially our chief guest today, Dr. Kiran Bedi. We would like to welcome you, and our guest of honors, Dr. Saraswati Kalwakota, Ms. Manisha Bhatti, and Dr. Mahendra Dewal. And also I would like to thank our organizing committee, moderator Arun Ayagari, Agam Pandit, Monica Dhawan, our host today, Sabita Bedesi, and Narsimha Tirunagari, and Srinivas Guduru, the secretary of the Lead India Foundation. And I would like to also thank all the academic partners and media partners who are supporting this initiative. As Sabita already mentioned about the Lead India Foundation, we've been doing a series of webinars, especially during the COVID times, to encourage people to be positive about, and also to take care of themselves, to be safe, and keep their friends, families, and neighbors safe. If you look at today's numbers, the pandemic has impacted, still going on. In the USA, we crossed over 34 million people, with 622,000 people succumbed to COVID. And India is trailing behind with about 30 million people and over 400,000 people affected with the COVID. So it's very unfortunate that we are going through these pandemic times, which impacted the health, education, economy, and employment due to restricted mobility. The rise in the case numbers has been exponential in the second wave, especially in India. The pandemic has affected large populations across the cities as well as rural villages. Again, this is really, really devastating. Many Indian cities are reporting a chronic shortage of hospital beds. And also it's evident that the desperate cries for help on social media platforms are disturbing reports of people dying without getting timely treatments, especially lack of oxygen. And this also really affected the side effects of extended stays in the hospitals, impacted many of them with the black fungus, white fungus, gray fungus, and various other side diseases that really devastated people to drain their savings in treating their dear ones. So we started this webinar series on May 1st, launched by the Honorable Governor of Telangana State, Dr. Sundar Rajan. Through this webinar series, Lead India is bringing global healthcare professionals to provide expertise, guidance to address the COVID-19 wave 2 in India. The program has been very successful. In the process, we received several requests to provide to support on-the-ground relief efforts. For example, the ambulances to move the patients as well as to move the deceased bodies into cremation centers, PPE kits for the frontline workers, as well as the people who are involved in taking care of the patients post departure from the hospitals as well. So we successfully attempted to support such requests, and there's a number of requests are still pouring in. So in this process, thanks to our youth director, Agam Pandit, who brought in a very, very renowned person who cares beyond her job, Dr. Kiran Bedi and her foundation, India Vision Foundation, to collaborate with the Lead India Foundation to truly provide the relief efforts on the ground, especially in the North India. And we welcome Dr. Kiran Bedi for joining hands with us. As I said, again, for any project to be successful, we need 3 T's. Dr. Kalam used to say, time, talent, and treasure. So we need the time of our volunteers, talent who have some experience in this area, like the physicians and the technical team who was supporting us, and also treasure in order to provide the services truly needed on the ground. So this particular event, we would like to dedicate to the India Vision Foundation to spread the message of the kind of relief efforts they are doing on the ground, so that the supporters of Lead India and India Vision Foundation can open up their wallets and also the time and talent to support this initiative to do wonderful life-saving events on the ground. So I would like to echo the great American President John F. Kennedy's words to his fellow Americans during his inauguration. Ask not what your country can do for you, ask what you can do for your country. This is a call for action to the public to do what is right for greater good of the society during these pandemic times. This calls for a great deal of introspection and pricks one's conscience to think to convert every adversity into opportunity to serve. Again, let's give back to our communities and collectively transform this world. Like Mahatma Gandhi said, be the change you want to see in the world. Being a spectator and expecting to change will never happen. So we need to be part of the game to make a difference. And this webinar series also carefully selects expert global panel speakers on healthcare, especially who have worked on the ground in terms of providing treatment to the patients and also the vaccinations. We have Dr. Deval also, who is going to provide some input into the potential impact of the 3rd wave that is expected to have hit the world in the next few months. Again, finally, I would like to recite a favorite poem of our mentor, Dr. APJ Abdul Kalam. So where there is a righteousness in the heart, there is beauty in the character. When there is beauty in the character, there is harmony in the home. When there is harmony in the home, there is order in the nation. When there is order in the nation, there is peace in the world. Again, peace comes from harmony, and harmony comes from the beauty of character. Our focus is to building character of our youth so that this world will become peaceful and harmonious for everybody to live on. So again, I just wanted to mention the upcoming event we are hosting. After orbiting around the sun for 83 times, Dr. APJ Abdul Kalam left this planet on July 27th, 2015, while addressing the IIM Shillong students on the topic of creating a livable planet. We are organizing an event on this occasion on July 27th at 7:30 p.m. to remember our people's president, Bharat Ratna, Dr. APJ Abdul Kalam, on his anniversary and pay tributes. And we would like to welcome all of you to join us on that day. Once again, I would like to thank each one of you, especially the India Vision Foundation, for coming forward to join hands in providing the relief efforts on the ground during these pandemic times. Thank you so much, and we welcome you all.
Thank you very much, Dr. Harry, for those very kind words. At this point, I'd like to welcome our webinar moderator, Arun Aigari, who is also the Vice President for Lead India USA. Lieutenant Arun Aigari is an editor, journalist, and talk show host. He's an advanced pilot, drone pilot, first lieutenant in the United States Air Force, and a colonel in the Commemorative Air Force, among his other accolades. Arun has been honored with a citation by the New Jersey General Assembly for Community Service and has had a number of awards as Brigadier General um, Charles Yeager Award by the U.S. Air Force Auxiliary. He's been recognized by East Brunswick Public Schools on the eve of Veteran Day. I'm privileged to work with Arun on this series that we bring forward. And Arun, I'd like to welcome you now as moderator of today's event.
Yeah, thank you for the kind introduction, Sabita. The host, Sabita, welcome all. Welcome, Dr. Kiran Bedi and Monica Dhawan from India Vision. We look forward to the partnership. Sabita and Dr. Hari covered pretty much everything about COVID. The only other point I would like to add to the series is COVID is one of the topics we cover. We also focus on sustainable development goals. We conduct a number of webinars related to sustainable development goals set out by United Nations. That's also one of Dr. Kalam's dreams. So yeah, please join us in one of those webinars also. I would not like to take too much time. Time is short. So Sabita, please go ahead and introduce the next guest. Thank you.
Thank you, Arun. At this point, I'd like to introduce Nitya Chachri, a volunteer at Lead India, who may have a few words to say on behalf of Lead India. Nitya?
I don't think Nitya is on. Sabita, we can move on to the next speaker.
Nitya is not on. Okay, my apologies. Now, I'm privileged to welcome Dr. Kiran Bedi here today with us. Dr. Bedi is an Indian politician, social activist, retired police officer, and she plays a sport that is very dear to me. She's a tennis player. She's the first Indian female to become an officer in the Indian Police Service and started her service very early on in 1972. She remained in service for 35 years before taking retirement in 2007 as Director General, Bureau of Police Research and Development. Dr. Bedi has a number of accolades to her title. She was crowned the junior tennis champion in 1966. She won several titles at various national state level championships after
you can
joining.
Skip that all.
Okay, so at this point, I'd like
let's save time. Yeah, let's save time.
Okay, I'd like to introduce Dr. Kiran Bedi to the forum.
Thanks, Sabita. That's very nice. I like to save time wherever I can.
No worries. It was my passion for tennis.
And you can save certainly your own time particularly getting yourself introduced. But thank you very much. I want to thank an institution which is inspired by a people's president, Dr. Kalam. Dr. Kalam and I also had a very good association in many, many ways. He actually presided over the annual day of the India Vision Foundation. We have such wonderful, memorable pictures, Mr. Chairman, that he came. And just one small invitation to him with the request to come and do it for the annual day of the India Vision Foundation, he came. We will share these pictures with you. I'll request Monica to share these pictures with you. Just as he's associated and he's inspired you, he is inspired and associated with India Vision Foundation as well. As you know, he loved education and children particularly. So therefore, we all both share a common mentor. And it is that what has inspired us also to associate with you, Mr. Chairman, and certainly the information given by Agam Pandit, as he explained to us, who are you and who are your inspirers and who's your mentor. So thank you for this wonderful association which we are forging towards. Monica will give you full details, the director of the India Vision Foundation, as to what is our COVID relief plan, Mr. Chairman. But in those 5 minutes that you've given me, I would list out these few things, which if we can get very proactive on, which will have a direct benefit for the cause with which we are coming together. Number one, which we've realized that the biggest victims, by the way, the India Vision USP is save the next victim. And I think the biggest victims of COVID, not only us as elders or whatever, have been the children. Silently children, because they've remained locked down. They're not into schools and they're not out on the playgrounds. They've stayed cooped up in the rooms, in the houses, and they've lost out on education. the wealthy, urban wealthy who had connectivity, the research is saying that at least 60% of the rural, 60% of the rural have dropped out of education for reasons of connectivity. So if we have to focus our efforts, we could, and India Vision Foundation has a very large constituency of working with the rural children. So we can do, if we, once we work, the Lead India and India Vision can galvanize support together. What could we do? Number one, improve the connectivity, gadgetry access to the children who dropped out on education, which means maybe buy up straight away, get them, buy a smartphone, get them a tablet. Now, tablet may not be new, even second-hand tablet, but functioning tablets. Second, payment for connectivity, which means we pay for connectivity. They don't have the money to pay for connectivity. Number one, pay for connectivity straight into their account, or we tie up with a connecting agency which provides the connectivity to them, and the India Vision creates a corpus which, by your support, and we pay the provider straight away. That means they get a tablet, they get connectivity. Third thing they've lost out, which our survey is showing, is they lost out on school fees. They don't have the school fee because the parents have dropped out. They've lost employment. As you very rightly said in your paper, it's been hit. So parents don't have the money to pay for online education from the schools which would have provided. So children who may have had connectivity do not have the school fee to pay for the children for online school, for online education. Third is, as I said, tablets. Fourth is they're terribly in need of counseling. We need a counseling linkages with children who can connect. That means we need a professional dedicated at least 8 to 12 hours a day for a counselor, child counselor, to speak to the children on a regular basis, which means either we have a volunteer counselor, but obviously Hindi speaking counselor, or we have a dedicated, engaged child psychologist counselor who could speak. Next point, my friends, would be upskilling of their parents, because parents have lost their jobs and the job market has changed. So how do we upskill? So that means we also need to strengthen the parents, strengthen the mother, strengthen the father, so that they can provide for their children. And last but not the least, my point here is nutrition, where India Vision Foundation, Monica Dhawan will explain to you, we've been sending food packets to their homes, but we need to sustain it for a while, because COVID is not going to go away yet. I think we may have to work with the children, handhold children till the normalcy returns and the parents get back to their feet. So, but I think our first target should be save the next victim. And the immediate victim is children before us. These are the areas I think, if as a foundation, Lead India and India Vision Foundation, if we can work together, we can rescue many children who are dropping out of school. And children who drop out of school, particularly girls, are heading for early marriages. And when early marriages means a lot more social evils will stop it. So here we are, Sabita. Back to you. If you can now, I've said it in the few minutes I had.
Yeah, Dr. Bedi, you are given 15 minutes. And if you could take some more time and address the youth and others who could probably get inspired with your speech, if you can.
You said 5 minutes. This
No,
paper
it
says 5 minutes.
15 minutes and Monica gets 10 minutes. You both have from 25 minutes.
Good.
Actually.
So I will
please
now
go ahead, use next 10 minutes to address and inspire and motivate everybody who could join hands with us on the ground. We need more hands to do this COVID relief efforts. Please
I think Monica now steps in. No problem. She takes over where I'm leaving and give you a little more details about the COVID relief plan.
Yeah,
I request Monica to explain.
And then you can come back again after Monica's speech.
I'm with you. I can certainly come back.
Thank you so much. Yeah,
Monica, could you please explain?
Yeah, thank you so much, ma'am. First of all, I would like to thank Lead India Foundation for joining hands with India Vision Foundation. And the India Vision Foundation is a 27-year-old organization founded in 1994 by Dr. Kiran Bedi. And the vision of the foundation is to aspire towards a crime-free society by initiating reformation programs for the prison inmates and giving them opportunities for released inmates to get reintegrated back into the society. and also starting a lot of welfare programs for the parents, for the children of these incarcerated parents, to save them from becoming the victim of their parents' incarceration. Before I share a few our COVID response, I have a small video about the foundation to make you all understand how and where we work. So a small video to just showcase our work. So Subit, can we play that video, please?
Yes, you can play. You can share your screen and go ahead. And please click audio.
Do you know that there are over 11 million prisoners in the world? According to the National Crime Record Bureau, approximately 4.5 lakh prisoners are held in all 1,361 jails across India by the end of 2017. Out of these prisoners, approximately 4,31,823 were male and 18,873 were female. Today, growing crime rate is a big concern for India. Three main pillars of criminal justice system in India are police, judiciary, and prison. The task of the police is to enforce the law on the people. Then, the courts are supposed to hold a proper trial of the criminal with the help of the lawyers and witnesses. Finally, the convicted persons are held in the prisons, also known as jails. There are three categories of prisoners. 1. Convicts. Convicted person in India is referred to as a prisoner as he has been sentenced a punishment by a court or a court-martial. 2. Under trials. A person under judicial custody who is facing criminal trials in the competent courts. A person who has been committed to prison custody with pending investigation or trial by a competent authority. 3. Detainers. Any person detained in prison on the orders of the competent authority under the relevant preventive laws. According to the NCRB report, at the end of 2017, 68.5% of the total prisoners in India were under trials and 30.9% were convicts. Imprisonment is an extremely traumatic experience for the prisoners as they have no productive activity and they are devoid of any personal development. This gave birth to India Vision Foundation in 1994. The NGO is the brainchild of Ramon Magsaysay Award winner, First Lady IPS of India, Dr. Kiran Bedi. Mission and Vision. The foundation aims to establish a crime-free society by various reformation and reintegration programs for prisoners and released inmates respectively. It also runs numerous welfare programs for their children so as to protect children from becoming the next victim of their parental incarceration. Presently, the foundation runs 5 programs. Based on 3S model, Shiksha, Sanskar, Skills or Training and Development. ECCD program for the children inside prison. Children of Vulnerable Families or CVF. Inside Prison Reformation Program. Training of prison officers and staff. Rehabilitation and reintegration program for the released inmates. This 25-year-old NGO is changing 3,000 lives per day and is trying to instill a new ray of hope in the lives of the inmates of prison as well as their children. The NGO aligns with Sustainable Development Goals or SDGs to ensure no one is left behind, not even prison inmates under the 2030 Agenda. No poverty, zero hunger, good health and well-being, quality education, gender equality, reduced inequalities, peace, justice and strong institutions, partnerships for the goals. Be the change you wish to desire. Join hands by strengthening our mission to save the next victim. Connect, volunteer, and donate.
So this was a brief about our work, and presently we are reaching out to many deserving and the children also. Our response to COVID started from the day one, and here I would like to share with all of you that our work was inside prisons. And during the first lockdown in March 2020, all the prisons were closed, and especially the Delhi was totally under lockdown. and we were not allowed to go outside also. That is the time where India Vision Foundation innovated and reached out their beneficiaries by using virtual technology and by talking to our beneficiaries every day. So we started our response to COVID with an initiative known as Helping Hand, which where we intervene to the beneficiaries on the need based. When I could talk about need based, then totally it is the need based interventions while we keep connected with our beneficiaries, be it released inmates, be it with the superintendents of the prisons, and with the children and their parents. So we started with giving them reliefs, how we can provide during the lockdown also. And during this pandemic, till now, we have benefited more than 82,000 beneficiaries through our various interventions, which includes starting from safety essentials. So the first thing in prisons was that there was a lack of safety essentials for the inmates, and most of the prisons in India are overcrowded. So we provided safety essentials such as masks, sanitizers, thermometers at that point of time to help them to overcome this pandemic. The second most important need which came from our parents and our children was of ration supply. But since it was a lockdown and we were not able to go and deliver the ration themselves, then we adopted a new technology while we connected with the grocery shops near their areas, and we use the Paytms and Google Pay. We pay to the grocery shop, and they collected and they delivered the ration support to the families into their home. So that was the innovative way where we have reached out to the children. The third initiative which we took was of the health and hygiene kits. That was the most important requirement for the beneficiaries inside prison, because all the visitations were stopped while being inside the prison, and there was nobody to get the basic amenities of clothes, slippers, even the sanitary napkins for the female inside the prison. So we provided them regularly health and hygiene kit so that they can overcome all these challenges which were coming. As rightly said by ma'am, mental well-being was the most important area where our team get regularly connected with each of the beneficiary, be it child, be it their parents, because there was an adverse effect on the mental well-being of the children. So we did a lot of e-counseling with our children also. And into this, we even launched an online counseling program that was the first of its kind in Indian prison, where an online counseling system was developed, where the psychologist was interacting with the inmates through online, through laptops. So this was a major area where mental well-being was taken care of. And this is the need which is required right now also, because most of the parents in the communities where we are working, they have lost job, they have lost hope. So our counselors, our social workers are in regular touch with them, giving them a lot of hope, giving them a lot of positivity, and motivating them to give them awareness about a lot of government schemes and programs, so that they get involved in some or the other government scheme rather than getting them dependent on India Vision Foundation. We are helping them to make their government documents also, so that they can avail the ration the government is providing them on regular basis also. So that's how we are working with. We do a lot of awareness session upon the vaccination, because there was a misconception in the society, and especially with the underprivileged communities where we are working, that vaccination is not good for them. So we did a lot of vaccination workshops and a awareness drives with our parents, with our beneficiaries inside prison, and motivated them to get back into the vaccination. And there, I would say there is a good response from the prisons in which we are working, especially in Haryana and UP. 90% of inmates inside prisons are vaccinated, and all the prison staffs who are the frontline workers are also vaccinated. So this is a collaborative model where an NGO and the government organizations are coming together to overcome and coping mechanism of these pandemic. And as ma'am said, technology and requirement of connectivity, especially with our children, is the most dire need at this point of time, because schools are closed, children can't go and play with their friends. So they need to have to be connected with our social workers. We have a lot of a pool of our volunteers and interns who are regularly working with us to work with the children in the communities, into the resettlement areas of Delhi and NCR, and in rural areas also. So I think this is the response of COVID of India Vision Foundation, and many more such response is required here in Delhi and NCR region, because COVID has not gone yet. We all know that this is a phase where we all have to join hands together and sustain and help these underprivileged communities so that they can overcome this pandemic. I have a small video to show how we have reached out to our beneficiaries in this time of pandemic. So Sumit, can we have that video also?
बंद करके देना, फ्रेश ही देना, फ्रेश ही देना।
So this all could have been possible only because of the trust and the kind-hearted support of our individual Indian and global donors, our corporate partners, our volunteers, our interns, and tireless and compassionate team of India Vision Foundation. I would like to join hands and request Lead India Foundation to join us in helping more such beneficiaries. Thank you so much.
Very, very impressive, Monica. Very nice to see all the things happening we are very happy to have partnered with the India Vision Foundation to take this forward. Again, this need is beyond our times, so it will continue. This kind of effort is needed, especially transforming the youth into responsible citizens, that Dr. Kalam's dream. All these children who really lost their parents and all, they need definitely all the things, mental support and financial support, and also the educational support that India Vision Foundation is already leading that effort. We'll be happy to join. Now I would like to welcome again Dr. Kiran Bedi to address the viewers of this session and motivate and inspire them to join us in this journey.
If I would carry on, I would say we all now know the problem. We also all know the extent of the problem. We just have to declare a time plan and declare what are we going to do. Now we are at the doing stage. Who is going to do what? Who has what extra to do? As you very rightly said, do they have time? Offer time wherever it's required. Do they have the talent? Offer the talent wherever it's required. You have the treasure? Offer the treasure where it's required. I think let's go back by the same 3T concept you said. We now are at the action stage. We know the problem and we know the gravity, and we also know the time constraint. If we don't do it now, by the time people are growing up, time is not going to wait for children particularly. So if we are focusing on children, it's not waiting, they're outgrowing already. They're going to go out of school, they won't even go back to school. They've got to get used to it. It's going to be quite an effort to bring them back. So time is now. So if we could have a next 2-3 months plan, who will do what? Declare that, put it on the table, and declare and implement. I think, Doctor, that is the main target at the moment. It's not about knowing the problem. It's about doing with the problem, dealing with the problem, grappling with the problem, and then declaring and implementing. So it's honoring a commitment now. If we can do that, I think it'll go a long way. And India Vision Foundation has very good partners around the country. So we can stretch out. We have gone up to the middle of India. We have gone up to prisons in Madhya Pradesh. We've spread out beyond Haryana and Uttar Pradesh. We've gone to Punjab. We've gone to Madhya Pradesh. So India Vision can connect you with the children in need. So I think time now is to declare talent, time, and treasure. That's it. Put it on the table and have a 3-month plan, and let's come back after 3 months to see how much did we do, who did what. Honor them. Let's honor them for talent. Let's honor them for treasure, and it's all of them for time. Let's honor. But I think we need to now have a time-bound plan for the next 3 months. That was what I would say, Doctor. We know the problem.
So absolutely. I think together we could make a difference. We definitely need partners like India Vision on the ground. They know the reality and they know where the need is, and also how to distribute that need to reach the people who are looking for such need. So we need to provide them mental health, physical health, as well as provide them the education so that they could earn their living respectfully post-COVID and come back to workforce, especially the parents who lost their jobs. We need to upskill them, as you rightly said, and the children who deserve to go into the schools with good nutrition and health to educate themselves so that they can become responsible citizens as well. So I think it's time, as you rightly said, we will collaborate closely and work with Mr. Agam and Monica will work together to get this plan out, fleshed out, and so that we could take the responsibilities to do what is needed in this pandemic times. We are blessed to have you, Dr. Bedi, on this session, as well as joining hands with us in taking this forward. Any closing remarks to the viewers? Dr. Bedi, please go ahead.
As I said, I think it's time for declaration. I'm impatient for now action. You see, I think that's the point. And at the moment, it's not the size. We can begin small. Let's begin small. And once we do, we already have the list of beneficiaries who are waiting in the wings to be benefited. So that means as soon as the support, as soon as we all can all generate more support, it goes straight away to the beneficiaries, to the bank accounts of the beneficiaries. As Monica said, we have gone to the grocery shops, the Paytms. So it's such a wonderful, transparent thing. That means school fees can be paid. This year's school academic can be saved. So I think at the moment, your Lead India members, whoever they are, tell them each one, okay, what will you contribute? In kind, in cash, or in time, or in talent? Tell us that. You are a member, what will you give? So it's like a subscription. Now this is a subscription of giving. What is it? You are all a member of the Lead India. That's a matter of pride. But now what are you giving for being a leader? Show us the leadership. So what is the leadership will show? I think it's time to declare and then pool it and then start seeing and evaluating how much have we done. I come back to the same thing again, because now last 2 years, we all know the problem. Now we are into problem solving all the time. So while the government of India policies is how much money is being given, it's all going into infrastructure now. It's thousands of crores, 25,000 crores again have been dedicated for infrastructure support, oxygen plants, child hospitals, name it. All those things which didn't exist. Ayush, I think we can even link Ayurveda. I think if any one of you is linked in, we can even link Ayurveda support. So not only allopathy, we can introduce Ayush, which government of India has even strengthen government's hands for that. So let's work on, once again, Dr. Chairman, sir, is declare you are a member of the Lead, bring one more friend. You will bring one more member, one friend. So let's have a chain. And next 3 months, let's declare how much this synergy between Lead India, which is a product and vision of Dr. Kalam. And even by 27th, you can repeat this, Will. I think that will go a long way in really respecting what Dr. Kalam stood for.
So definitely, if your time permits, on the 27th, we would like to welcome you to join us as a speaker as well, so that we can talk about this also. We'll work with Monica and Agam to see whether that's possible with your time permits. 7:30 p.m. on 27th, which is a Tuesday. So we are committed, and we will move forward. Arun and Sabita and our team will reach out to the membership, and they've been supporting, and we did on an ad hoc basis so far, as and when there's a request come. Now we are structuring this so that this continuously helps to the people on the ground. And also we have some partners, as you mentioned, on the Ayurveda and homeopathy side. We could bring them also on board so that you could coordinate locally with our partners to streamline and have a focused way of dealing with the requirements through Ayush as well. So since you worked in the government, I think you know how to maneuver the government system as well, because there's some obstacles we faced during when we transferred the funds into various FCRA accounts. So we are still stuck, not reaching the accounts somehow. I think working with India Vision, those kind of problems can be eliminated moving forward, I believe. So with this, I think we can move forward with the next speaker, Arun. Thank you so much for joining us, and we look forward to working with you, Dr. Bedi. Thank you.
Thank you, Chair. Thank you, Chair.
Thank you, Kiranji. Thank you. Thank you so much.
Dr. Hari, would you like to throw some light on the event on July 27th as well? Or you want to wait?
Yes, yeah, definitely. Again, as you all know, we lost Dr. Kalam, who left this planet on July 27th while addressing the IIM Shillong students around 6:30 p.m. The topic was creating a livable planet. And Lead India is committed very much to propagate the vision and mission of Dr. Kalam. And we adopted 7 of the 17 Sustainable Development Goals. The same India Vision also done that. So we have a lot of synergy here. So on July 27th, 7:30 p.m. India time and 10 a.m. Eastern time, we are hosting to pay tributes to Dr. Kalam a webinar, and we're inviting some global speakers on that day. So we would like to welcome all of you to attend that event. And one of the star speaker is a 110-year-old who last year received the Padma Shri Award from the President of India for planting trees around along the highway in Tumkur and near Mysore, I believe, 4.5 kilometers. Both husband and wife adopted that 70 years ago, and she's 110 years old. And she's also joining us to speak about environment and sustainability and those kind of things. And we have a few other people from the United Nations and Africa and Australia. So it would be nice if Dr. Bedi can join us on that day. And we welcome you all to watch that show as well. Again, our ultimate goal is to make a difference on the ground and the kind of activities India Vision Foundation is doing. And we'll be delighted to propagate that message as well during that global event. So this is, the pandemic is global, but we are addressing the local problem of India through this particular session. So let's open our hearts and wallets to support this initiative. You've been doing that for the last 1.5 years now, but the time is more, especially to address the needs of the children whose dear ones are gone to COVID. So I think we would like to welcome you one more time to this show. Arun, please take it forward.
Yep. Thank you for that wonderful introduction, Dr. Bedi. I have a quick question. Great introduction, by the way, of all the work you guys are doing. You guys focused on the prisoners initially. So is focusing on criminal justice reform also one of your goals, or are you focusing on helping in general?
Every time we go into a prison reform, it is global, it is criminal justice system. As Monica explained, the 3 pillars, one of the 3 pillars of criminal justice system is prisons. And we are very uniquely placed. There are not many organizations who can enter the prison with the kind of credibility we have. Every time it's an India Vision Foundation asking, suggesting a training program, prisons welcome it. Why? Because we have a 25 years of history of working sincerely with the prison. So it's a part of the reform. And then when you talk of reform, one of the key ways is you are expediting the criminal justice system, because every prisoner who shows reformation, gets bailed. he gets bailed because the prison report to the court is that particular prisoner followed certain programs, educated, skilled, and the magistrate releases him because he's getting the benefit of the skilling which IVF and prison administration works together. So that means it is a reform. It's giving him faster justice. And it's also helping the courts release a person out. It's decongesting prisons as well. So reforms which India Vision is doing inside the prison is leading to reforms in prison system in India. It's also setting the agenda and it's spreading. Now, it's not limited. The more and more prison officers are asking for more training from IVF. Why? Because they want to reform the system. They want to humanize the system. They want to upskill the prisoners. Now, that's reform because an upskilled prisoner, reformed prisoner, does not come back to the prison as a repeated crime. Is that big relief to the society? It's spreading society, social security, because the man is not repeating the crime. It's a revolving door. It's being shut because otherwise I get into a prison, I go out, I come back again. But the persons who are going through such reforms do not come back. They go back to work. Somebody's learned to cut hair. Somebody's learned to stitch and tailor. Somebody's learned data entry. Somebody's learned hairdressing. So all of them are not coming back. The research is showing those who attend to good programs in partnership do not come back. The recidivism comes down. So that's a part of the reform. Your mic is off.
Yeah, sorry. Thank you very much for the clarification. Sabita, please go ahead with the next speaker.
Thank you very much, Dr. Beatty and Monica, and thank you, Dr. Harry and Arun. Dr. Beatty, I just want to say that in Houston, I am affiliated with a couple of those rehabilitation programs with ex-cons and getting them back and geared up for society. So if you'd ever want to do a partner program in Houston, I could probably introduce you to a couple of those organizations here.
That's a good idea. You can arrange something like a conference call, but or a Zoom call between us and them, and we can exchange ideas of how we're working, how they're working. We can do a sharing. We can.
If you could, I guess I'll get your details from Agam, and then we can get that set up to create some collaborations here in Houston on what they're doing for, especially the female prisoners as they get out into society. It's a lot of mental coaching, counseling, a lot of forgiveness for them in terms of how do they deal with it emotionally and build back their confidence and even equipping them for jobs. So I'd be more than happy to do that. And on the educational arm, we as Lead India would love to work with you. Here in Houston, we are going back into full force. We're actually wearing no masks. Our Governor Abbott has declared a no mask policy because he wants the state to open back. We at the university I work at, we are preparing for a fall 2021 where we're going to have everybody back in class. So I can talk to you about some of those strategies we are using to get people geared up after being online for the last 12 to 18 months. So happy to share all of that with you as well.
So let Agam and Monica work together to do a conference, a Zoom call, but Zoom, let's say a Zoom meet between Houston and India Vision Foundation.
Perfect. Happy to help. Our next speaker, at this point, I'd like to introduce Dr. Saraswati Kalvakota. I'll tell you a little bit about Dr. Saraswati. She's a board-certified pediatrician and internist associated with Wright State University faculty and an assistant clinical professor in Dayton, Ohio. She's involved in a number of teaching a number of clinical medicinal programs to residents and students who are training to become physicians. She has over 30 years of clinical experience in primary care. Dr. Saraswati, I'd like to introduce you now as our guest. You're on mute, Dr. Saraswati.
Okay, can you hear me?
Yes.
Okay. Thank you, Sabita, for your nice introduction. It's been my privilege and honor to be here and listening to all the speakers, especially our chief guest and Monica. So far, it's been a big inspiration and motivation for people who are viewing all our audience right now. And also, of course, we are all in this same mission too. The topic is that about the coronavirus. I would like to focus right on the medical part of it, because the wider aspect of the disease process has been addressed, and we have come to a stage, one stage we have reached. And before saying more about coronavirus, the health is the important part of human being. Health is the birthright for human beings. It crosses creed, race, ethnicity, and it also crosses whether a person is poor or rich. It doesn't recognize any of that. And every human being has to enjoy the health so that he can function in the society productively. He can balance his life in so many other aspects of life. So why I said this in the beginning is the one coronavirus, smallest virus we cannot even, is smaller than even other viruses and the bacteria, has caused havoc. We all know that. And it has really done damage to the extent we cannot even imagine. And this pandemic has taught us a lot of things. And at this point, the coronavirus, as I heard in the beginning, it is not over. And that's the reason we are remembering and reminding the what it has done and what is ahead of us and what kind of precautions and measures we have to take to really fight this disease or weaken this virus. So just give you a little statistics about this. 184 million people are affected by the disease. They tested positive, and we have 4 million deaths in the world. So I heard the initial US statistics, but this is the global statistics I want to explain. And this is unacceptable, totally unacceptable. And it is important to know now that knowing what happened, what can we do in the future? And I will talk about that with a few questions. I will raise questions with myself and then answer so that we know how clearly we get an understanding of that particular question. So what is that we know about this virus? This is a coronavirus. We all know it comes in the adenovirus group, and most coronaviruses are benign, but unfortunately this turned out to be a dangerous and aggressive and virulent virus. And this one has 3 different variants: alpha variant, beta variant, and delta variant. So these are I want to bring these variants because every time we talk about this virus, this coronavirus, people want to know, what is this delta variant? What is this alpha variant? What is happening? You know, how do we know which one we have? The answer to that is the alpha variant is the one which started off in December 2019, and January onwards, it has gained its momentum. Alpha variant started in UK and then spread to USA, and it has caused a havoc, and we are slowly recovering from it now, hoping that it is the end of the coronavirus. Now, after that, the other countries got affected, and Asian countries are more with this Delta variant, and South Africa countries are affected by beta virus. Okay, so this is, I'm not saying why this country, I know that you can ask me a question, why this country, this particular virus, we do not know. But all that we know is alpha variant was virulent, and we came to know Delta is even more virulent. and beta is also more virulent. So the virulence, the aggressive behavior, destructive behavior of this virus, the Delta variant, now it is dancing in the world right now. And that is the new kid on the block for this destruction now. So the Delta variant started in South Asian countries. And then now in the United States, it is now 49% of the cases tested positive are Delta variant now. So now you see how this virus is thriving well universally, and as if there is no one to kill these viruses. We have found so many medications right in the beginning. They were all tried, and some of them didn't work, some of them worked, and we still have a lot of research going on in this detecting, investigational research going on in various medications. And we are succeeding to a certain extent. We have used steroids, we have used remdesivir, we have used monoclonal antibodies, we have used a combination of the monoclonal antibodies. So we have used in the beginning plasmapheresis, and all we have tried. So, and of course, not least, the oxygen was a vital supplement which was needed desperately, and it was not available at that time. It's better now. Okay, so the Delta variant part is what we found out is that we are finding out that it is not as effective to vaccinations as the Alpha variant. Monoclonal antibodies, which are given in the early part of the disease. So that's the only thing we are looking at, that monoclonal antibody may not be as effective as the Alpha virus did in the past. So that is something new. And then we also know this Delta virus, it just kind of escapes our antibodies circulating in our body. So that's the reason it multiplies, and then it kills our own defense mechanisms. So somehow it is because of this protein spike variation. It does not, it escapes the fighting mechanism, defense mechanism human beings have, and it makes itself way to several organs and lungs and other parts of the body to make it very destructive to the person. So I just touched upon the variants, and now we are coming to know about the Delta Plus, which is another variant coming off of the Delta variant. Now, I'm not going to scare you all what are all these variants mean to and what they're going to do in the future. These are all nothing but the genomic sequence of the particular DNA of that virus is changing. And any viruses has that quality. They tend to change their genomic structure. So like a flu vaccine or other vaccines, we do that every year, vaccines, because the genomic structure changes. So that's the reason we have to come up with a new vaccine to kill that particular virus. So having said that, I don't want to take a lot of time anymore. Now, what is the solution is what I would just touch upon for a couple of minutes. The solution is vaccination, vaccination, and vaccination. Nothing but vaccination. And following the preventive measures, we have always been doing it with the keeping ourselves sanitized well with our hands, keeping the masks on. And of course, the countries which are relieved a little bit from this virus are announcing to go ahead, have taken off the masks, but not many countries are having that luxury yet. So please follow these instructions for preventing virus. That is the key. And of course, the other one is, as I mentioned, vaccination, vaccination, vaccination. This vaccination is the only hope we have to kill this disease or to make this virus weaken so that it does not, so that our antibodies produced by vaccinations will fight the disease. Because 60% of the people, if they get vaccinated, 60 to 70% of the people, when they get vaccinated, we get herd immunity. That herd immunity makes, that means larger population are protected with the antibodies. And that's the reason we want to really see that populations, all these people in the world get vaccinated. Whether it is a small country, whether it is a big country, that vaccinations have to be conducted. And the statistics we have is 11 billion vaccinations is what we need to vaccinate entire population. So 11 billion vaccinations is not easy to produce. There are a lot of countries are coming up their own vaccinations, and United States also has now 3, fourth one is coming. They're trying to supply worldwide, but the thing is, it is not, it's the process, it takes time to go to different countries. And even the countries, different countries are coming up with their own vaccinations. It takes time, but till then, the measures, preventive measures, which are outlined right from the beginning, have to be followed. And the vaccination is the only solution, because 70% of the population, when they get vaccinated, they get the herd immunity. The other way you get the herd immunity is when they get the disease. And in the disease process, you get so many morbidity and mortality happens. You don't want to do that. Vaccination is the safest solution to beat this, to fight this disease and weaken the virus. So, take home message, if I can make everyone convinced at this point of the coronavirus stage, please vaccinate yourself, vaccination. And the children over 12, it is allowed to, they can get the vaccinations. Elderly people, definitely. Young age, young adults, definitely. So please vaccinate yourself to save yourself, to save your family, and to save your community, and you save your country. So that's all I would like to send the messages. And I'm really impressed with our chief guest, Kiran Bedi, how she has formed the organizations. She identified the reasons, areas where it is definitely needed. So as physicians, we are still doing a telehealth visit somewhere in Andhra Pradesh. I'm involved in that. So they call us because there are in small areas, there are no doctors there. Some of them are there, but that's not enough. So we talk to those coordinators, we tell them, what to do. So this is a telehealth thing, we did it, we are still doing it. And then our organization, physician organization in the United States, is the one of the largest organization, Indian organization, and they have picked up on this, and they have spent millions of dollars and working through several organizations in India. So everyone is doing something to help the country. And please vaccinate yourself and save yourself and save the countries. That's all I have to say. Thank you for giving me this opportunity to say about this virus and how to help the communities.
Thank you, Dr. Saraswati. Great information. Thank you very much. Just to add to what Doctor said, the variants, the names created a little bit of uproar politically and administratively. What happened was people started calling the names of the variants based on the country they originated or country they impacted. Initially, they called UK, there's South Africa, there's Brazil, there's Indian. So that created a lot of problems globally. So they named the variants by the Greek alphabet. So alpha variant is UK variant, beta is South African variant, gamma is Brazilian variant, delta is Indian variant. So we do not attach the name of the country against the variation of the virus, so that doesn't cause a problem. So I just wanted to add that. And then we have Delta Plus now, so I hope we don't go beyond that. So thank you, Dr. Saraswati.
Thank you for bringing that up. So far, we know all these variants are, the vaccinations are effective. 98% of the vaccinations are effective to all the variants we have. They are here now, and they also say Delta Plus also can be effective too. The vaccination is effective to the Delta Plus virus. So please, let's not really look at which country or what. There is no need. That's why they came up with the alpha, as Arunji said, alpha, beta, and so that doesn't represent any country. And we have right now in the United States 49% to 50% are now Delta variant. So it is not proper to identify a country. It is proper to go with these numbers. And good news is that we can vaccinate any virus, any coronavirus, regardless of their variants. That's all. Thanks.
Yeah, thank you. Thank you so much, Dr. Saraswati. Since you are part of this, I'm assuming it's OPI. So that they're already doing a lot of service, but we are now collaborating Lead India and India Vision with to help the children who lost their loved ones, who care for them and they need some psychiatric help, I believe. So a wing of RP, if we could work together under your guidance and leadership to bring those physicians who can help and provide the mental health support through India Vision Foundation on the ground, we can have a separate call to see how we can structure that program to have a telemedicine, working with the local coordinators on that aspect. That would go a long way, especially the young children who are really suffering because of the loss of their parents. We can have Arun, if we could coordinate a separate call with Kiranji and Dr. Saraswati, so that we could streamline the RP's help under her leadership to provide such help that can really make a difference in the young minds.
Yeah, that's a great point, Dr. Hari. RP is a, Monica, in case you're wondering, RP is American Associations of Physician Indian Origin. Is that right? Yeah, that's a pretty big organization in the United States. Physicians of Indian origins, basically. That's like an organization. So I'll inform you, and we'll work on that if that's okay with India Vision.
And so if Kiranji is still on the line, I just wanted to mention, with Dr. Saraswati's permission. So Dr. Saraswati is the daughter of our late Prime Minister P.V. Narasimha Rao Garu, who we celebrated his 100th birth anniversary in a big way. And I'm a big fan of him. He visited my home in Choppadandi, Karimnagar, when he, as a HRD minister, to launch the Jawahar Navodaya Vidyalaya. So I just wanted to thank Dr. Saraswati for joining us today. So we are very happy to have you on the show, and your clarity in providing our viewers different variants of the COVID virus, and also the solutions that are offering. You are very simplified that process, and biggest thing is to vaccinate and also follow the COVID guidelines. Thank you so much for joining us today. And Monica and Arun and Agam, please work out a process where we could have Dr. Saraswati to lead us in recruiting the psychiatric and psychologists to help our children on the ground. Thank you so much, Dr. Saraswati, for joining us.
Thank you. I guess we're all fans of late Prime Minister P.V. Narasimha Rao's intellect. So thank you very much, Saraswati. If anybody has any questions, please go ahead. If not, Sabita, please, let's move on to the next speaker.
Thank you, Arun. Thank you, Dr. Saraswati.
Sure, thank you.
At this point, I'd like to ask Nasima, who's one of our directors at the Lead India Foundation USA, to play Dr. Kalam's video, the transition video.
Sure, Sabita, thank you.
there is righteousness in the heart, there is beauty in the character. When there is beauty in the character, there is harmony in the home. When there is harmony in the home, there is order in the nation. When there is order in the nation, there is peace in the world.
Thank you, Savita. Back to you.
Thank you very much, Nassimo. And now we move on to our second guest speaker. Our second guest speaker is Ms. Manisha Bhatti, and she's the CEO and founder of Dream Hunt India. While reviewing Manisha's profile, I was really impressed of how she's moved from corporate banking to motivating students and working with a lot of young minds, molding the younger generation to be equipped for corporate jobs and guiding them with best techniques through counseling, mentoring, and coaching services. Manisha, I'm really, really impressed with the work you're doing, and I'd like to invite you now to the forum. Thank you for all that you do.
Thank you so much, Sabita, for the introduction. And first of all, I would like to thank Dr. Hari, Mr. Arun, and the entire team of Lead India for such a beautiful initiative, which is on throughout again and again with so many web series. And I feel proud and privileged to be a part of such a beautiful platform. Once again, thank you, everyone. So quickly, let me tell you what is my main purpose to be a part of this initiative. Plus, why did I come up with Dream Hunt India? So me coming from an orthodox or conservative society or family, I can say there were instances where I could feel that there are still instances where a girl child is not being accepted. So me being the fifth daughter in the family, I've realized that there is still a lot of biasness when it comes to a son and a daughter. That is where I started realizing that this is not what I want my life to be. So at the age of 18, I was forced to stop my education. That is where I had to actually stand for myself and, stand for myself and snatch that right as to I am going to get educated. So that was the first step towards my life, towards taking the decision for my own self. Second was when at the age of 18, my parents and the relatives and the society decided that, you know what, you're just 18 plus now, and it's your chance to get married in spite of the education that we will continue for you. We promise you for the same. So that is where after a failed marriage of 5 months, I was into a legal case for 3 years, which actually showed me the outer world, which broke me completely. But again, it taught me so many things. The third part comes into the picture comes into my life when I was stopped from working into one of the topmost investment bank, that is Deutsche Bank. As a fresher, I worked in Deutsche for 2 years as a financial analyst. That is where in the corporate world, I realized that the world out there is so much. There's so much to learn. On the other side, there are so many talented people in the corporate world, but when it comes to putting forth your ideas confidently, there are a few skill sets that we can collectively work on to be a better version of ourselves. And that is where I started realizing as to how I can be a part of this, when simultaneously I was also taking up classes of 11th and 12th standard of accountancy and banking. Then comes the fourth part of my life when I decided to leave my corporate job and get into this entrepreneurship world called Dream Hunt India. This was an institute. The core focus of this institute throughout was, initially, of course, we started with career counseling, corporate etiquettes. It was an imbalance in the starting because I believed in networking. I believed in taking those decisions towards learning moreover and then growing simultaneously. But then this entrepreneurship journey has shown me the other side of life completely, right from networking, right from making me feel that I am really very young. You are too young. Oh God, she's a female. She's going to get married again. She's going to get kids. We never know. We should appoint her. Should we actually give her the contract or no? So there were so many things that I had to actually face being a young entrepreneur when I started my journey of entrepreneurship at the age of 22. And today, it's been 5 years. Dream Hunt India has actually transformed thousands of lives. I can tell you this proudly because the programs that we organize are precisely onto 4 segments. For those females who want to be financially independent, emotionally independent, physically independent, and mentally independent. I think all these 4 have definitely been very, very near to my life as well. And it is a lot much relatable to the thousands and lakhs of girls out there who are unfortunate to stand for themselves. But I can assure you that there are so many girls who are very talented, but they just need that one step, that one push from us trainers, that regularly we should work on their skill sets. We should help them via listening to their concerns and also helping them out as to how things can be better. How rather earning the respect of your parents and the trust of your parents can actually transform your life rather than absolutely going against your parents. And I can proudly today say that my parents, though the same parents today, are so proud of me today, because even if I'm coming late night, even if I'm any decisions that I'm taking for myself or for my institute, they're always with me. And this is what I've earned. This is what I want each and every female out there to be a star out there, so that we are an inspiration. Every story, I understand, is going to be different, but it is definitely going to teach your environment some or the other things. So that is where Dream Hunt India, quickly let me tell you what are those 4 segments as I told you about. First is financial independence, which is professional excellence that we call, wherein money, networking, communication skills, and career makeover we can help them out with. And in COVID, we have definitely done that. The difference was that it was all virtual. And before this, it was all offline, wherein we used to go to travel. We used to literally travel pan-India, go to colleges, universities, schools, at times NGOs, orphanages, and have those interactive sessions and activities where people are involved practically, and they're also understanding, moreover, the concepts that we are trying to make them understand. That was one thing. And then comes the emotional independence, which we also called as emotional muscle. We need to be very strong in that. That is where comes the love life, family, priorities, dependency, and also whether the choice is yours. You want to cry or you want to conquer. So that is where the dependency, that still there are females who have either on their parents or on their brother or on their spouse as to should I go for this work or not go for a work? Should I choose entrepreneurship? Should I go for a job life? So there are so many dependency when it comes into the picture, and that is where we want you to start taking up decisions confidently for yourself. Then comes the mental independence, which was very, very crucial and very important for us to explain in this COVID times. And there were so many lives that we have helped, and so many people have actually helped us by opening up and by being a good listener as well, while we were making them understand the concepts as to how things are going to fall into place and how you need to respond rather than react. Then comes into the picture is the physical independence, which is the educational awareness that we create to them. How mental maturity is so important in the coming future, right from technology, right from social gatherings, right from social media. There are instances where we feel like there should be success, which is overnight, which is not possible. I think there are training programs that we have designed which are super effective, and people are understanding concepts where these social media makeovers can help them in understanding these concepts and also applying the same. Then one more concept comes into the picture, where premature babies, girls are not well educated when it comes to giving birth, mentally, physically, and also financially. So there are instances, a good amount of ratio where after maternity leaves, there are very high chances where females are not able to come back to their office job or to their entrepreneurship job. That is where I think we can collectively work towards that and help and start taking these training programs and workshops in the best of the MNCs, because I can, as we all know that MNCs are actually so powerful. Plus, on the other side, they are giving us immense opportunities. The sad part is that well-educated, graduated, and post-graduated girls are still sitting at home in spite of having those degrees. And you know what? They choose to completely completely pay attention on their parental life rather than also balancing out and delegating their work with their spouse. Then comes into the picture is the judgment part when it comes to society, relatives, social makeover, and also social gatherings and appearances. I think there is a lot of fake judgments that are being made in our mind as to there should be everyone who should accept us. So that is where we need to bring up that spark in those girls via our trainings and workshops. And that is where yesterday I discussed our vision with Lead India team, JD Prince sir, and also with Dr. Hari. I would love to be a part of Lead India initiative, and also together if we could make a change into the lives of these females so that the ratio of future female leaders is much better compared to the current part. So this is what I wanted to say. Thank you so much, everyone. If any questions, I would love to answer them.
Thank you, Manisha. Great speech. We spoke earlier too. We connected on several topics. That's absolutely amazing. And sure, we want you to be involved. We'll work together on this. And you're part of Lead India. So yep, anything you need, we'll work together on addressing several of the issues you mentioned. And we look forward to working with you. Dr. Hari, any comments?
Yes, definitely. The reason we brought you on board, Manisha, is now, as you see, that we are partnering with the India Vision Foundation, and the women who lost their main earner in the family, let's say a husband or a elder son, or now they are stuck with problems financially and also coping with this situation mentally. Also, they are drained. So if skilling and reskilling is the need of the hour, upskilling. So if your organization can join hands with Lead India and India Vision on the ground to mentally prepare these women who are helpless at this point in time, because they drained their finances to the hospitals to save their loved ones and also their children. Now they are desperately in need of such mentorship and guidance to identify their skills and what kind of opportunities they have if their skills are not able to find the job to earn their living. So we need to upskill them. So Arun and also Monica, again, we need to have a separate call to see how we could team up with Manisha's foundation and start the work on the ground. As our Dr. Kiran Bedi mentioned, it's time for action, the talk, and we understand the problem already. So we can create a process where Manisha's foundation can get involved firsthand to identify the kind of training programs that we can offer based on the need and different geographies that we can roll out this program. So I dragged her like a 11th hour. So I woke her up and said, can you come and speak? And I had a much bigger thing in mind, not just to speak, but post of this event, we need to work together to make a difference on the ground. Manisha, please be prepared and come up with some good ideas. We are born with a purpose on this planet. Dr. Kalam always said, it's time for us to give. If not, we would have born as something else, a tree or a mountain or some kind of insect, but we are born as human beings with two hands. That means we are here to serve. I think that's the kind of message, and this is the need of the hour, so that we can make a difference in somebody's life, so that they can earn their living respectively. The government cannot continue to support, and we know that. So if we can stand on our own feet, that's the biggest gratifying experience we all can have, and people like you can make a difference. Arun will follow up, and that's the reason I wanted to connect you with Arun. So he has a lot of energy and creative ideas to streamline the processes, so that we could do a program that can make a difference. And Monica is also here with us on representing the India Vision Foundation. So our goal is to collaborate, not to compete each other, but complement each other, so to make a difference. Thank you so much for joining us today. Arun, back to you.
Yep, that's so true. Thank you, Manisha. That's so true. This is why I connect with Hari at a different level, because what he said is very true. We could have been born as something else, not just something else. Instead, we were born as someone, not something. So there's a reason why God created us. So I think everybody should play their part, and everybody has a responsibility. We just have to find out what our calling is. Once we find what the calling is, we should work towards that. In this case, our calling is, Lead India's calling is to working towards a better and livable planet, as Mr. Kalam mentioned. So thank you very much. Manisha and Monica will work on this together after this. I hope, we can continue this partnership. Sabita, please go ahead with the next speaker.
Thank you very much, Arun. And I've turned my video off. I hope you guys don't mind too much. My internet is a bit spotty, so I do apologize. Manisha, great work that you're doing. And Arun, just to add to what Dr. Harry said, he reminded me so much about my father. My father used to say, God has given you two hands and we have to use it for a purpose, and it is to serve. So, great messages from everyone we've heard from so far. At this point, I'd like to introduce our third guest, our third speaker. It's someone who is a part of our family, someone who's committed to our cause and has really been a key part of this initiative. Dr. Mahindra Dewal, who's a founding member, head of research and product development at Expansion Technologies in Cambridge, Massachusetts. Dr. Dewal is a biotech entrepreneur and biomedical scientist with over 20 years of multidisciplinary experience across a number of research areas. He has spent a lot of time in developing the novel antibacterial and antiviral agents for HCMV and HIV infections. And when the pandemic hit, Dr. Dewal actually switched focus. He and his research team started developing monoclonal antibody therapeutics to fight the COVID-19 infection. Dr. Dewal has presented at a number of international webinars and participated on several panel discussions, and is always keen to share news and debates and facts, a lot of facts on COVID-19 infections and recent developments on vaccines, as well as the therapeutic remedy. Dr. Dewal has been recognized by the Ministry of Youth Empowerment and Sports at the government of Karnataka, and is associated with a number of human rights associations. And he is a champion for us for COVID-19. So Dr. Dewal, I welcome you again to the forum to share your expertise.
Thank you. Thank you so much for such a wonderful and kind introduction, Sabita. It gives me an immense pleasure to share today's platform with such an eminent personalities like Dr. Kiran Bedi Garu, Dr. Saraswati Garu, Ms. Manisha. So I would like to thank Lead India for giving me this wonderful opportunity. So today I'm going to speak about the possibilities of the third wave. That I have made a couple of slides that I'm going to share quickly, and then I'll get going. Can anybody see my? Oh, you got it.
Yeah, we can see.
We can see that.
You can see that, right?
Yeah.
Okay. All right. So does the third wave inevitable in India? So what I did was I did some analytics on the real world data, looking at the other countries, what's going on in the other countries, the rest of the world. So how they are dealing with these waves and variants and things like that. So my next slide, this is the statistics, worldwide statistics. I listed a few countries that are competing in the cases. You can say, India used to be 5th position, but now it came to the 2nd position based on the number of new cases with the second wave that hit the country a couple of months ago. But fortunately, it's still in the 3rd position in the deaths number compared to the US and Brazil. But let's look at data, how each country fighting. First example that I took is Israel. So here on the left side, the plot shows that number of new cases. It's a rolling average of 7 days, raising per day per a million people. So you can see the first wave, second wave, here are there, and so the waves are there. But now you see there's a little spike, probably because of the variants right now, like in July month. But let's take a look at the hospitalizations. It's pretty tightly controlled, right? There's a small hike, it's 1 or 2 cases, but it is not like very highly considerable. But one another data, you can take a look at this. Again, it's for per million people, rolling average of 7 days. The deaths completely controlled. It's zero, almost zero in Israel, right? It's a great country, very well controlled. But why? How this has happened? The best reason, the only reason is vaccinations. You can see that approximately 63% of the population, the country's population, got at least 1 dose of the vaccine, which shows the importance of the vaccinations. But the variants, again, spike in the cases, number of cases. That's because of the variants. So a good example to learn from this country. The second example is UK. Now there are 2 waves. You can see that which already. The 3rd wave, you can see the spike in the cases, in the number of cases, increase infections. That's because of the variants again. But see the hospitalizations here, down here. So very well tightly controlled, and deaths almost zero, right? Even in the first 2 waves, the death rate is very high. But now in the 3rd wave, the death rate is completely controlled. And the spike in infections is due to the variants again. But how the death rate and hospitalizations are controlled? Again, the vaccinations. 68% of the population of the UK got at least 1 dose of the vaccine, which shows the importance of the vaccine again. And they're very close to the herd immunity. If you reach to the 75% percentage population receives at least 1 dose to 2 doses of vaccines, they're going to go towards the herd immunity. The next cases I analyzed for the United States. Take a look at this. The first and second waves. You can even these little bumps you may call 1, 2, and 3, or whatever it is. The waves these are the previous waves, and there is a bump in here. But you can take a look at right now in July, what's happening. There is a little small spike. Again, that's due to the variants, but hospitalizations nearly zero. And the death rate, first 2 waves, death rate was really crazy. But now you can see that the death rate is quite controlled. Again, it is due to the vaccinations. About 55% of the population of the country received at least 1 single dose, indicating the importance of the vaccination. So now what we learn from here is, even though variants increases the spike, but the vaccines controls the hospitalizations as well as the deaths. Let's take a look at another country, which is the Brazil from the South America. So here, if you look at the Brazil, this is the first wave, and the second wave started somewhere in November. It's never ending. Still ongoing, the second wave. Now it's kind of low, slowly it's coming down, but you never know what's going to happen here. And the hospitalizations data, we do not have any idea. The data is not available, unfortunately. But the death rate, the first and second wave, highly increased, but it seems like it's getting towards the controlled. It's kind of going down. It's being controlled. Again, this is due to probably the vaccinations. Still, the country, according to the population, they're only 38% of the population vaccinated, which may not be sufficient, right? That's what is probably causing this spike. What kind of other factors? Let's take a look at. I did a little bit more deep dive into the reasons why Brazil, there is no control on the spike in the cases. So there's a nice article, a news article published in the New York Times. The reasons that they highlighted is, number one is, the most important thing is the vaccine scarcity. They don't have enough vaccines to vaccinate the people, number one. And the second thing is, people are not practicing the COVID adaptive behavior. That's another big problem, because you can see the shopping malls are open, restaurants are open, their beaches are open, they're going crazy, and they're not wearing the masks. This is one of the other reasons. In addition to that, again, the variants. the Brazil itself has a gamma variant, their own variant, in addition to delta and beta variants. So variants also is the reason for not coming the cases, daily new cases down in Brazil. And the next example is South Africa. Again, in South Africa, the third wave already started. You can take a look at the case number, daily new case number went more than 300 cases per day per million people. And unfortunately, we don't have any hospitalizations data from the South Africa as well. But again, the death rate is increasing. First wave, second wave went down, and the third wave, it's already started. Death rate is increasing. There are multiple reasons could be. And the vaccinations, you can see that only 6% of the population got at least one dose in South Africa. Again, I did a little bit deep dive into what could be happening here. In South Africa, the major problem is the vaccinations. They're not getting enough vaccination because they don't have their own vaccinations. The country is not developing, but they're totally relying on the World Health Organization and the rest of the other countries in the world to get vaccinated their own people. That's one of the reasons. Second thing is the Delta variant. I mean, the Beta variant already from the South Africa, it came out. In addition to Beta, now they're experiencing the cases from Delta variant. So vaccine scarcity and variants are causing that spike, the third wave. So there is something to learn from this data as well. The next country is Russia. So Russia seems to be controlled very well for the first and second waves. It came down and then third wave started, it seems like in Russia as well, including the death rate is going all the way high. We don't have hospitalization data, unfortunately. The very interesting thing is Russia is one of the countries that started developing a vaccine from the beginning, early stages, and then they got the vaccine approval probably before the United States and the rest of the world, in fact. And the vaccination rate is very, very, very low. 18% of the population was vaccinated only. That could be the reason for hiking in this the spike in the cases as well as the deaths. What's happening in Russia? Let's take a look at the data. So again, this article published in New York Times indicating that the major problem in Russia is the vaccine hesitancy. You can see that, most of the people, they're not trusting their own vaccine. They don't want to take the common people. That's a major problem causing the rise in the deaths, which indicates the importance of the vaccines as well. And the next thing is the Delta variant. The Delta variant entered in Russia, and that's another reason spiking the cases. The increase in the death rate is most probably due to the vaccine hesitancy, but spiking in the cases certainly from the variants and as well as the vaccine hesitancy. Now, from these countries, from this data, what we can learn, what are the factors that influence to get the third wave to come, to avoid the third wave, which is increase the vaccination, no vaccine hesitancy, and concerns towards the new variants. We have to be very careful. The third thing is following COVID adaptive behavior, which we can learn from the Brazil, where they're not following it. And what are the factors that increasing the chances of getting the third wave in India? Vaccine scarcity, vaccine hesitancy, and slow vaccination rates, and also variants of concerns as well. Then again, the third one is the most important one, which is people's careless attitudes, not following the COVID adaptive behavior, is one of the reasons that may cause to hit the third wave in India. But let's take a look at what's happening in India right now, the data. So daily new cases went down, all the way down compared to the second wave in a couple of months ago. This is a good news, very good thing. And even death rate is also controlled. That's probably due to this vaccinations and the lockdown that imposed a month ago. And the vaccination rate, if you take a look at that, 21% only people are vaccinated, which is very, very concerning because India is very densely and largely populated country, which we need to increase the vaccination rate to control the third wave not to come. But is that happening? Let's take a look at what's happening in here. See, vaccine hesitancy. I mean, my apologies for that. So people are not caring. They're not following the COVID adaptive behavior, and also the vaccination rate is not going as fast as it's supposed to go. So this is what I would like to say. What is it? So we still need to increase the speed of the vaccination, number one. I mean, this is an article published one in New York Times, which is in one day, 8.6 million doses were administered, which is really great, but it still needs to improve to vaccinate the country, most of the country, like the Europe and US, to avoid the third wave. In addition to the vaccination, people are not following their COVID adaptive behavior, and the variants. We have the Delta and Delta plus variants are, we have to be very concerned, and we have to follow this COVID adaptive behavior to control the third wave. And so I think, after finishing my presentation, you may have a better idea than me, but now you can say whether is it inevitable or is it avoidable, or is that there is a third wave is going to come on. So I'll let you answer this question. That's all I would like to say. Thank you. Thank you so much. I'm going to stop my presentation now.
Thank you, Manadeva. Great information. I do not have any questions at this time.
So I would like to request again, Dr. Dewal has been a great asset and advisor to our series of these webinars. And now we are stepping into a different role, partnering with like-minded organizations, synergistic organizations to save as many lives as possible. And Dr. Dewal has been doing a lot of research and a lot of predictive analytics on the impact of COVID in different variants and different parts of the world. And especially our focus for now with the India Vision Foundation is to prevent the kind of loss we faced in the second wave, and not to spill into the third wave. I think the vaccination is the key. And importantly, as Dr. Saraswati mentioned, following the COVID guidelines, distancing and masking, and also protecting the families, friends, and neighbors, that is the key here. And if Dr. Dewal can be part of this new alliance that we have with the India Vision Foundation, along with Dr. Saraswati from the US, to provide guidance, working with the Monica and Dr. Kiran Bedi to do what is needed on the ground, until and unless people like us, with your knowledge and wisdom and experience, the situation could get worse. And we are trying to collaborate here with your expertise with India Vision Foundation. And also we are not shying away from partnering with other organizations who can bring value here. Our goal is to collaborate and to save as many lives as possible. So Dr. Dewal, you being the lead advisor for this healthcare related issues for the Lead India Foundation, please, if you could take the lead working with Dr. Saraswati and also collaborate with Monica and team to see what can be done on the ground to prevent the loss of life from the predicted third wave, if we can.
Sure, absolutely, Dr. Hari. I'm happy to actively participate on whenever and whatever is required. Absolutely, I will work with Dr. Saraswati Garu and Monica to get going our collaboration. Happy to.
If I request Dr. Saraswati to make any comments after hearing from Dr. Dewal and also other speakers, please, if you could share your thoughts, how do we take this forward?
It's been a very learning experience also to me, how everyone is diversifying the core problems of current problem, which is coronavirus. Because it's unless we address core problems, like I just heard all this. These are the core issues which needs to be addressed, and it is a coordination more than anything else, because the way it should work is like a chain loop, and in that loop everybody has to be connected to make it a full circle. So as a physician, I can do my service, and I also have my own international organization, nonprofit, and I do that service through them. I do that service with the API, which is a physician organization, and I give suggestions. I talk about this subject matter. So if anything I can do in this regard, or anything else which I can do, I'll be more than glad to participate with Dr. Dewal and also with the Lead India Foundation, and also other foundation too, like India Vision Foundation. And after all, we all work for the same cause. And the more we get together, the more ideas, the brains work together will come up with more creativity. And I am there to be part of that creative mind, and then implement and do whatever I can. Thank you.
Thank you so much. And I just wanted to mention 2 weeks ago, my wife and myself were in Dayton, Ohio region with Dr. Alok Agarwal and also Dr. Vivian Reddy. And they happened to mention about you, and I'm very grateful for our Secretary Srinivas Guluru to reaching out to you to bring you on board.
Okay.
It's a very timely association with you, and we will definitely work with you. And again, we're all part of a bigger puzzle, and each piece of this puzzle is important. As you rightly said, we contribute based on our expertise and our availability of time, talent, and treasure. So let's make a difference. Even we can save a single life. I'll share one story before we pass on to the next speaker. During the first wave, I received a phone call around 4:30 a.m. and the other side, a wife of a patient who is in an ambulance, kicked out of a hospital to vacate a bed, giving a fake certificate that he's no longer COVID, but his oxygen levels were like without the cylinder about 65 to 70, something like that. They were on the street in an ambulance looking for a bed. They visited 3 hospitals. They could not find a bed. And in a desperate situation, they called me and to help. I was able to find a bed for them. And the patient was saved. After a week, he was discharged. And recently on January 26th, I lost my mother and I visited India. And the 12th day ceremony, we did that in an auditorium, and somehow this person came to know that I was in India, and I never met him. I don't know him. And he came and touched my feet and said, "Sir, you don't know me, but you saved my life." So I'm just sharing, I'm not boosting this, but I'm sharing indirectly or directly, we could save many lives. The simple gesture, I made one phone call to Dr. Guru Reddy, who was the founder of Continental Hospital, and he was kind enough to say, redirect the ambulance and we'll take care of it. And that's what happened. Simple phone call made a difference in that person's life. Otherwise, probably he would have died. So each one of us, if we can make some difference so that the life exists on this planet, not because of our gesture, but for their deeds also possibly, but we may become the instrumental in saving such lives. I think with this, I would like to thank each one of you for joining us today and willing to work together to save as many lives as possible on this during this pandemic times. Thank you so much. Back to you, Arun.
Yeah, wonderful. Thanks for that story, Hari. Well, the first time, obviously, Hari couldn't get into the details in the webinar, but when he shared with me on the phone, we got into a lot of details. It's actually a lot more emotional than what Dr. Hari made it sound because of the lack of time. I know the whole story. I heard it. Yeah, I think the point there is, like Dr. Hari said wonderfully, you never know. One call you make to some random person, you never know how that can impact his life. Impact a smaller word. How that can give life to the person, right? So that's the point Dr. Hari is trying to make. That's a great experience. I had goosebumps when I heard on the phone. Thank you for sharing that. So Narasimha, let's move on to the next. Can you play the Innovation Challenge video, and then Srinivas Guluru can give his comments?
Sure. Yeah. Let me share my screen.
Hello, Jakob Fagland here. I'm here to tell you about micro-investing, an approach to end hunger for smallholders. Smallholders represent 7 out of 10 of the world's hungry and are just rarely getting a job outside their sector. There is profitable options though, although they are usually not very available for the smallholders. What we need to do is kitify drip lines, maybe 2 times 15 meters, and related connectors with just a few high-quality seeds, enough for the bed. And the same, just a few hundred grams of water-soluble fertilizer, enough for 3 months for 15 square meter. By doing that, you get an investment, maybe $7, maybe $10, and that investment will return 5 to 15 times the money back in just 3 months. You reinvest them and you do the same again and again. When you've done it 3 times, we see people often getting $10 a day. Going from $1 a day to $10 a day is going from the bottom billion to the upper half of the world's population from an income point of view. That is micro-investing. And I've been working on it together with a few other friends in Tanzania, Malawi, Zambia for the last 5 years. So to learn more, check out my TEDx. You find more on my LinkedIn profile. You can also go to Norwegian Church Aid, who is the NGO who's involved in this. And I hope that many more will get involved in making micro-investing available for poor people around the world.
Hi, I'm Joseph Knoll from the Basic Internet Foundation. Our goal is to connect the unconnected and give everyone free access to information, which should be a human right.
We connect when nobody thinks that we are able to connect in Tsilela, in Isasi. And we empower our communities to connect. Please listen to Catherine.
Hey, Joseph.
Hi.
This is me with the team. This is Ben, the IT, and I'm Dr. Mkononi, the representative. We are here connecting the village of Kiparanganda. So yeah, behind us, is the antenna, I think. Yeah, it's very long. And but yeah, so far so good. The internet is very strong where we are. And yes, this is by the roadside. Yay, a very potential place. So yay. Basic internet, thank you for connecting one more village. Peace.
Arun, back to you.
Yeah, thank you, Narasimha, for playing that video. Just want to reiterate the video which we played just a second ago is just one, or these are just a few of the several accomplishments which Lead India made. This is definitely not fully inclusive list. Thank you very much. Srinivas Guduru, please give us your closing remarks. Srinivas is a secretary for Lead India Foundation.
Thank you, Arun. And it's really inspiring to listen to the galaxy of the specialist guests we have today. And I can see the plethora of responses coming on our Facebook as well as YouTube about the wealth of information that was shared by our esteemed guests. To start with, I would like to thank Dr. Kiran Bedi for her time and sharing the great work at the ground level they're doing. And as she rightly mentioned, if a prisoner is skilled and educated, he has every possibility of not coming back to the prison or going back to the crime. It's very important to educate them and empower them so that they can sustain life skills and lead a respectable life. Thank you, Kiranji. We are looking forward to working with your organization on the ground level. Dr. Saraswati Kalvakota Garu, doctor by profession, thank you for your details on various corona variants and your services to the community through API. We would like to convey our happy 100th birth anniversary of Sri P. Narasimha Garu, your father and our 9th Prime Minister of India and the architect of modern India's economy. Thank you so much for joining us. Monica Dhawan, Director at India Vision Foundation, thank you for an inspiring presentation on your services to the prisoners and their families during this pandemic. It's very important to provide the basic amenities of some monetary help as well as things in kind like groceries, so on. Excellent service, and we're really thankful to you, and we're proud to partner with you in this mission. Manisha Bhatti, the youngest co-founder, CEO of Dream Hunt India. Thank you for joining us and providing your insight into inspiring and transforming the lives of young generation. Lead India is committed to transforming the youth into responsible citizens, and we definitely are looking forward to work with you on making Dr. Kalam's dream possible. Dr. Mahendra Dewal, he has been on our expert panel on COVID for his excellent presentation on his third wave, and the stats provided by country and the details behind, how they were successfully handled the pandemic and control the numbers. Very informative, sir. As you and Dr. Saraswati garu mentioned, vaccination is a key factor for controlling the pandemic. And of course, as you rightly said, following the COVID behavior of social distancing, wearing masks. Agam Pandit, last but not least, the Youth Director of Lead India, for your untiring efforts coordinating with the India Vision Foundation and making today's event happening. Thank you so much. And thank you, Dr. Maruri, Arun, Narsimha, Savita ji. Savita ji, welcome back after a long gap, but hope everything is going well for you. Thank you, all the team, for your support stitching this great program together. Thank you, Dr. Hari Panapalli, for coordinating and bringing these excellent speakers, not only just discussing the issues, but basically finding solutions and implementing them on the ground. Thank you, everyone. Have a wonderful evening and a wonderful day.
Thank you, Srinivas. Again, I would like to thank everybody, folks from India Vision, Lead India team, and all the speakers. Thank you very much for your time today. We all thoroughly enjoyed our conversations. I'm sure everybody learned from each other today's call. We'll continue this partnership. We'll continue the conversations. This is not end all do all. We, like I said before, at the beginning of the call, beginning of the webinar, this is just one of the several webinar sessions we have. We planned and several other topics also in the future. So let's partner in those topics also in making and creating a livable planet. Savita, you have any closing comments? If not, we can end the session.
I'm fine. And I just want to offer thanks to everyone who give up their time and continue to give up their service. Thank you, everyone, for all that we do.
All right. Thank you very much. We can end the session now.